there's a whole host of groups like SEIU and ACORN that we would expect to be pushing President Obama's socialized medicine proposals, but there's an unlikely group stumping with them, AARP. Let's just say that these bills are not elderly friendly, so why is AARP helping these get passed? Here to explain is AARP Legislative Policy Director David Sertner. David, help me out on this one. Why would AARP be involved in something that is so unbelievably, clearly senior unfriendly?
Well, what we've been hearing from our members for the last many years is that they're really concerned about the cost of their health care, and particularly for older Americans on Medicare who've seen their premiums double in the last 10 years, spend 30% of their out-of-pocket costs on health care. Holding down health care costs is critical, and so it's a huge issue for our membership.
I'm sure it is. That doesn't tell me why you're supporting something that is going to clearly, it is inevitable, and it happens in every country, where they ration health care for seniors.
Quite frankly, Glenn, and thanks for having me on to clear this up, AARP would not support rationing of any kind. We don't believe in that, and we don't believe that these bills would do that.
Do you think?
Would oppose bills that would do that.
So, for instance, the policy advisors for health care for the president, they would never be for that, right?
Well, I can tell you what AARP will be for, and we're trying to fight to make sure that our members have affordable
I understand
health care.
But you're opening the door here to a system. I just want to know. You've been assured by the president that there would never be anything like that, right?
Well, the president told our members that there wouldn't be any benefit cuts, and we're looking to actually improve the Medicare benefits by getting a prescription drug program covered.
He also said that he wouldn't have any tax raises either, and watch it, it's coming. How about this one? How would you respond if I told you that Obama's health policy advisor, Rahm Emanuel's brother, Ezekiel, wrote in January, "The complete live system is what we need, which prioritizes younger people and discriminates against older people." In a 96 article, Emanuel writes, "An obvious example is not guaranteeing health services to patients with dementia."
Well, quite frankly, Glenn, we would reject that kind of rationing. And again, we don't see that in these bills. What we see in these bills, at least for the Medicare population, is changes to make the system more efficient, to help hold down costs, and to help make sure that people still see their doctors.
I have seen the efficiency thing, like the end-of-life counseling. That's fantastic. Seriously, you can just have somebody from the government come and talk to you about how you want your life to end, and get counseling every 5 years.
We would never support having the government or an insurance company interfere with these end-of-life decisions. And what the bill does now is make sure that you get to make. Well, what the bill does is make sure that you get to have a conversation with your doctor so that you can choose and you can make.
So are you saying that old people are not smart enough to be able to have that conversation with their doctors? You think that it's important that the government writes this into a law to be able to make sure that maybe they remind grandma and grandpa that their life is coming to an end? And why do you need to have that in a bill that you support?
Well, actually what the bill does, because many of our members want to have these conversations with their doctors, but Medicare right now won't reimburse the doctor for having this conversation. And what the bill will do will allow Medicare to reimburse a doctor so that you can have a conversation and you can make these decisions with your family.
I have to tell you,
insurance companies or the government interfering.
I have to tell you, I think it's just such a relief that our government can give those. Well, they're not voluntary anymore. You have to actually have I believe you have to have a court order to get your kids out of school for those voluntary sex education conversations that they said they were going to have with their kids. Purely voluntary. Now they're not. So that we can teach our kids, have the state teach our kids that it's cool to have as many children as you want, just keep having babies and don't worry about what mom and dad said. And then at the end of life, the government can come in and tell you when exactly, maybe you should lights out. Well, keep it up. You're doing a great job, David.
We're trying to protect and strengthen Medicare and make sure that all our members, both those on Medicare and those not yet eligible,
Medicare is broke. It doesn't work. It doesn't make any sense whatsoever to take Medicare and expand it. It makes no sense to take a broken system and then say, let's add this on top. It makes no sense. And sir, you at the AARP, who are supposed to be representing people like my parents and people like me eventually, you should be ashamed of yourself. You really should be
Well,
ashamed of
I think our
yourself.
24 million members on Medicare would disagree with you about the Medicare system.
No, I don't think so,
it's been
sir.
a lifeline to them in providing
I've gone
affordable
to
health
your
care.
website, sir, and I've seen we've canceled our AARP membership after 11 years. Is it true that healthcare would keep me from getting stents and bypasses if I'm over 59? This bill is not about, these are three different people. This bill is not about saving money. It's about government wanting control of our healthcare system. Is AARP becoming a branch of Acorn?
Well, I would encourage folks who want more information to go to aarp.org and look at some of the information on our website.
Yes. Well, I don't mean to scare the elderly by any stretch of the imagination. I just mean to tell them the truth, because I don't have any kind of financial gain or any political power to gain on this. Be afraid of national health care. Not because I tell you. You have your children go look into national health care in England. Go look at it. Go look at national health care in the wonderful Canadian healthcare system. It's a nightmare if you're old. It must be, because there are too many old people to too few young people. Where are they going to get the money? They're not. They're not going to get the money. Please, please, Mom and Dad, Grandma and Grandpa, please don't listen to people who, at times they might be honest brokers. Other times you might want to question, why exactly is this happening?
A company asks 13,000 workers to, quote, voluntarily walk away from their jobs. And guess what? They came up 7,500 short. Any takers on who's running this place? It starts with a G, has an E in the middle, and two N's. Take a guess.